Okay, we have about 2 more minutes, and I am just so glad that you're here with me today to take some time to learn about how to support children who have experienced abuse within their families. I posted guess it was last week on my Facebook page asking people to send in topics they would like me to discuss. And this topic was voted the most requested topic, and I can understand why. It's very painful to watch or be a part of a child's life who has experienced abuse and neglect. And we desperately want to help those children. And sometimes we feel lost. We don't know what to do. I can admit that I've been in that place myself before. Before I became a consultant teaching and educating others, I was a trauma-informed therapist for foster, kinship, and adoptive families. And in this work, I often dealt with the most unimaginable situations that children had to endure. And being new, a new therapist, and recently out of college when I started that position, it was tough. It was really hard to find the words sometimes, to find things that would help, to feel brave enough to try new things that would help. So I am with you in that place of maybe feeling fearful or afraid or just confused about not knowing what to do and how to help. And I also know that people who are caring for children who have experienced abuse are also afraid of creating more trauma for the child. So they often don't want to bring up these topics, or they don't know how to talk about these topics, and they kind of get pushed aside and into the background because we're just feeling too afraid to cause more problems. So I have some topics I want to talk about today, and I think you'll find this really useful and helpful information if you are a caregiver, if you are a parent, if you are a mental health professional who works with children, or if you work in a school setting or basically any environment where children are involved. Trauma is so pervasive in our communities, and the research has shown that by the time a child reaches 18, most of them have experienced some type of trauma. And trauma, if you're not familiar with what it is any overwhelming or distressing experience that makes it difficult for you or a child to cope with life, to function in a way that is productive and successful in the world. And it creates a lot of uncomfortable symptoms and also a lot of behaviors in children. And that's often why people would want to seek out help with me, was because they just didn't understand the behaviors, and they were really frustrated and angry with the children who were acting out because of the trauma they experienced. So because we're talking about abuse and parental abuse today, I just want to, give a trigger warning that this could be upsetting to some people who are watching, and I want you to know that it's totally okay to hop off of this whenever you want and come back and listen at a time where you're feeling stronger or more ready to do so. This is also for educational purposes only. This is not to replace any type of mental health therapy or treatment for yourself or a child. So please, if you are in distress, contact your local hospital or emergency line. We have the National Crisis Prevention Line, which is 988, and you can access that 24 hours a day, 7 days a week. You can even send a text to that number if you're not comfortable calling. So those are just some disclaimers before I dive into some of the content today. I would love for you to ask questions along the way, if possible, so that I can come back and answer them later. I'm not sure I can see the chat. I'm rather new to Facebook Lives. I'm very familiar with Zoom, but Facebook is a whole other animal, and I'm really coming out of my comfort zone today and coming on here to talk with you live because I want to get better at it, and sometimes we have to push ourselves, right, out of the nest and out of our comfort zone so that we can grow and reach more people, and that's really why I do this work. I do it so that I can change a little piece of the world with the information that I've gained throughout my experience as a trauma therapist. So that's a little bit about why I'm here. So a brief definition of abuse would be things like emotional abuse, sexual abuse, sorry, I'm drawing a blank, emotional neglect, which is like when a parent is unable to be emotionally present with a child and kind of denies the child's feelings, and maybe uses shame or name calling or put downs to harm the child psychologically. And there's also, verbal abuse. So that's similar to the emotional abuse, where they might be hearing awful things about themselves, being told that they can't achieve anything, being told they'll never amount to anything, saying that they hate the child, or things of that nature, being very critical of the child. So these are all different types of abuse that a child could experience, and oftentimes these are patterns that get passed down from generation to generation. And the word narcissistic was used in promoting this event because that was the word that my audience resonated with and asked for me to speak on. But I want to be clear that narcissism is a rare trait. It's a rare constellation of behaviors and emotions and actions that have been developed by human beings who wrote the DSM, which is the Diagnostic Statistical Manual, which is the Bible in psychiatry of how to diagnose somebody. And although I use the word narcissistic, I really don't ascribe to using a lot of labels for people. I think that underneath the root cause of all of these behaviors and problems is trauma. And if we can address and help to heal and prevent additional trauma, many of these disorders and other difficulties that people face, like anxiety, panic attacks, depression, and suicidality, would not exist if the trauma had not occurred. So there's nothing wrong with the person initially. It's that there's something that happened to them. That doesn't excuse abusive behavior, and I use the word abuse specifically because that's what it is. We do still have free will, and we do have choice over the decisions that we make. And so, this is abuse, and it doesn't, and a label like narcissism or narcissistic doesn't excuse the behavior, nor does the person's history of trauma. But it does maybe explain some of what's going on. And that can be important information for a child to know if it's age appropriate, because many children blame themselves. Just like us, when we mess up as adults, who do we blame? A lot of times ourselves. And children are especially apt to do this because they are very self-focused as children. They are very, what would you say, self-centric. They kind of are looking at themselves, and they feel as though they are in control of a lot of the world based off of their behaviors. They have some magical thinking that takes place at different ages of development, where they think that they could say something and then that event could happen. So the imagination of a child tends to kick up blame into their system and into their body, and also shame. And so when they understand that the way they were treated by their parent or their abuser was not their fault, and was actually due to maybe extensive trauma that their parent never processed through or had any support or healing for, that can help to mitigate some of that shame and blame. I hope that was clear and easy to understand. I see some people saying good morning, thank you. Hi Joe, hi Christina. I'm so glad you guys are here with me today. I think we have some really good stuff to share and talk about. Hi Dawn, how are you? It's so good to see you. I know I can't see your face, but I see your words, and I'm grateful that you're here. So let's get into some more of this. So I kind of gave you an overview of what I think narcissism is and where it stems from, and what I think abuse is and where it stems on. And you'll find different opinions out there from different people, but this is my set of opinions and beliefs, and you can feel free to take what works and leave what doesn't for you and your family. I believe that I had a family member with some of these traits in my ancestry, based off of stories that I've heard, and I've seen the damage it can do to children and the harm it can cause. And so I'm right there with you, and feeling a lot of this personally, and the topic has activated some feelings in me as well, and some thoughts. So I'm glad we're here talking about it. Hi Vineet, I hope I'm pronouncing that right. I'm glad you're here. Please feel free to say hi to me in the chat, and of course, please share any comments or thoughts, concerns, questions, and I will do my best to answer them. Of course, I can't really give, again, therapeutic advice, but I can give you some general tips and guidance to help you through these hard times. So, one of the most important things to understand about the effects of child abuse is the trauma, obviously, but also the fact that it creates a lot of mixed feelings within the child. So, the same person who is harming them is also the same person who might be showing them love at certain times or care or concern. Some people are not always abusive. There's breaks in the abuse where the person is loving and kind. And so it creates a lot of dissonance, a lot of internal struggle of, I want to love this person, and this person sometimes is loving towards me, but they also hurt me and they also have caused me a lot of pain. And so there's this challenge of holding two different beliefs and feelings about a person at the same time. And that's something a lot of us struggle with, called cognitive dissonance. It's a fancy psychology word that I learned in school. But it speaks to something that's so universal, and it's that internal tension that we feel when we have two conflicting beliefs, or when our behavior and our beliefs don't match up. Though that can create also a lot of cognitive dissonance. So if you're somebody who drinks alcohol, but you also believe that it's bad for you, you'll probably feel a lot of anxiety and tension around that behavior of your own, because it just doesn't match up. You're not in alignment with who you believe you are, and how you believe these things can affect you, but you keep doing something that is harmful to yourself. So that kind of feeling gets kicked up in the child as well when it comes to their relationship with an abusive parent. So although they are feeling scared of this person, sometimes they aren't scared, and sometimes they are feeling like this person cares for them and loves them. And there's also this innate belief, I believe, in children, that our parents are supposed to love us, and our parents are supposed to care for us and never harm us. And so when they do, that also creates a lot of confusion and questions, like why would my parent abandon me? Why would my parent hurt me? There must be something wrong with me. So the first thing that you can do to help children, the first practical thing you can do, is make sure you're sharing that message with them, that this is not their fault, that the way the child has been treated is 100% not because of anything they did. And you may think this is obvious, right? Because it is obvious to us. We know children are innocent and that they don't intentionally cause harm to themselves from other people, but they don't always recognize or understand that because of their self-focused mindset. So it's really important for any child you're caring for, working with, to make them know that it is not their fault that these things happen. And it may be the first time they ever hear it from you, which can be a really powerful moment and a catalyst for healing and change. So I encourage you to have that tough conversation with them if you can. The other thing that affects children in these situations is something called ambiguous loss. And I do whole trainings and presentations on this. It could take hours to explain all of it. But I want to give you a little taste of it, because I also think it's a really valuable concept to understand what these children are really struggling with in their minds and in their hearts and bodies. So ambiguous loss is something we all experience from time to time, but some instances are more intense and more traumatic for people than others. A common everyday type of ambiguous loss might be the tension and feeling you have around going to work while your child is at school or in daycare. So although you want to be with them and you want to be spending time with them, you have to go to work and you have to be separated from them. And during that time, you are experiencing a form of ambiguous loss, because the child is still here in the world with you and part of your life, but physically they are not in your care, they are not in your proximity. And so this can create, again, that anxiety and that tension of wanting to be with someone who's unable to be reached at the time for whatever reason. That's one type of ambiguous loss. The other type of ambiguous loss is when the person is physically present but psychologically absent or unable to meet the needs of a child. And this would be the type we see with narcissistic parents who are still in the picture. So while they are in the child's life and they do have proximity to the child, they are not emotionally available for the child. And this is the case with many children who grow up with abusive parents, and it's a traumatic form of loss that that goes unresolved, unacknowledged, and is very difficult for a child to understand because there's no social construct for it. There's nobody who brings it up. There's no grief process when this takes place. And most of the time, people don't even know it exists or that there's a word for it. So this is another tip that you can use with a child who may be experiencing some type of ambiguous loss where the person they love or care for is still alive, but is unable to be reached either physically or psychologically. That could be from substance abuse, it could be from incarceration, lots of different problems and mental health struggles. So I encourage you to look up ambiguous loss. The expert on this topic is Pauline Boss, and she is the creator of the concept and the theory. And I encourage you to dive into whatever you can find to read of her books to understand how to support children through that process and to help them overcome their grief. And again, I do offer training on this topic to multiple organizations. In fact, I have one for the Wichita Children's Home coming up at the end of April, and I'm really excited to meet their team and share some more about ambiguous loss with them. The other thing we can do is work on building trust above all other priorities. So yes, grades are important. Yes, sports are important. However, with a child who's experienced abuse, neglect, or abandonment, or significant loss, it's critical that you focus on building trust and positive interactions between the two of you in order to help rebuild the trust that has been lost by the people who were supposed to care for them most in the world. When a child is abused by their parent, they change their worldview. It goes from believing that the world is a safe and steady place to now believing that even the people we're supposed to trust can harm us. And so that sets our nervous system up and their nervous system up to be hypervigilant and on the seek for threats everywhere and from every person. Because if you can't trust your parent, who can you trust? These are really, really painful experiences and realities for these kiddos to face. And so building trust has to be the foundation of any relationship that has experienced trauma. There's ways you can do that. Obviously being as honest as you can with the child in age-appropriate terms is one way. Making sure that you keep your word and you're as consistent and structured as you can be. Now, of course, we can't always keep our word with kids. I wish we could, because when you don't, it's a mess. I have a 7-year-old, and when plans don't go as scheduled, I hear it and I get a lot of backlash. So I'm with you on how hard that can be, and that sometimes it's just not possible to be as consistent or structured as we want to. However, when we know that there's a change coming up that they weren't expecting, we need to tell them right away. Holding off until the last minute to kind of surprise them with it so that it's too late to have a meltdown, or being dishonest because you're afraid of the meltdown or the tantrum that they might have, is not a good approach to take. It's not the most beneficial approach to take, because that breaks down trust. So what I'm saying is, try to be consistent and as honest and open as you can about the situation in the child's life, whether it be the babysitter's coming tomorrow night because we're going out to dinner and we need someone to watch you. Don't wait until the last minute to tell them that. You might want to tell them that morning so that their brain has some time to process it, and be honest. This is what we're doing and we're going out, and you will be safe in the care of your babysitter, and framing that around the idea that you're trying to build trust, not just avoid a tantrum or a meltdown. And of course, that can be the trickier path to take in the short term. But in the long term, building that trust is way more beneficial for the child than any tantrum or meltdown that you might have to handle in the moment. Also remembering that, tantrums, meltdowns, big emotional outbursts are a chance for the child to reset their nervous system. Sometimes kids need to get it out. They have valid rage that they're holding in their bodies from the things that have been done to them, said to them, and the people that they've lost who are supposed to be there for them. So when you see a child who has an outburst or an explosion of emotion, although that can be painful for us to sit with, especially if we have our own trauma and we feel triggered, knowing that that behavior has a purpose and is like letting the steam off of the boiling pot and is allowing the child to eventually reset their nervous system can encourage us to sit with it and to stay present and to not flip our lid and lose our temper. Just knowing that this release of emotion can actually be very beneficial for a child is helpful for everyone. So I encourage you to remember that the next time you're faced with a big outburst, whether it's a young child or a teen. Sometimes we just need to cry, and sometimes we just need to let it all out, and we need a safe person to hold and accept that pain for us so that we can move forward. The next tip I'd like to give is that one thing we can do, and this is kind of two things at the same time, but one of the most important things we can do for children who are, separated from their biological family members or struggling with an abusive parent is try to keep something positive about the person in the child's life. So maybe this parent is not safe enough to be with the child. Safety always comes first. But maybe there's a hobby that abusive parent had, or maybe there's a favorite meal that parent liked to make or to buy. And it may seem counterintuitive to continue to have some sort of connection to that person, but it can actually be very beneficial for a child to recognize that there is still something good in that person, because especially if it's a parent that has caused the abuse, children will identify with their parent, which can also create a lot of shame and difficult behaviors because they think to themselves, well, if dad's narcissistic, if mom's narcissistic, if they're bad, if they're losers, if they're these terrible, harmful people, I must be too, because I came from them. I must be like them. And our culture gives that message all the time, like, oh, the apple doesn't fall far from the tree, and, oh, you're a spitting image of your dad or your mom. These are things in our culture that are commonly expressed to children, and they internalize that, and they recognize that if dad or mom is a bad person, then I must be too. And so if we can create something positive to bring into their life about the child, about the parent, that can often release a lot of the shame that they're holding on to. And like I said, it can be little things like, a joke that dad used to tell, an age-appropriate joke. So that's another one of my tips. And then to go along with that, I said this is kind of like two parts, is avoid making negative comments about the child's parents when possible. So, children are very perceptive and much more observant than we would ever know. They are literally picking up on every tiny thing that we say and we do because they haven't had the chance yet to have their nervous system as numb as adults have, right? We've kind of learned how to, desensitize ourselves to a lot of things. But children, they don't, right? Their nervous systems are, they're tuned up. They are ready to take everything in. They're fresh and hot. They want to learn everything they can. So if they hear or overhear you bad-mouthing or talking negatively about their parents, again, they're going to take those messages and internalize them into their belief system about themselves. So one of the most important things we can do is to try to stay neutral or positive about the child's biological parents, so that we're not adding to their shame, we're not adding to a negative self-image that they might be trying to navigate already. I hope that makes sense. Let's see, I'm going to check the comments just to see if there's anything. Oh, yes, I'm going to have some printouts that go along with the webinar. And yes, you can share them within your CASA group. I wonder, I should probably be able to, I'll put them in the chat once I'm done so that you can go back and get them. It's links to some handouts and some additional supporting information. Another question, let me see. Okay, some of these are really personal. When is yelling abuse? That's a great question. I see lots of great questions here, and I know I can't get to them all in the next 6 minutes. So what I will do is, so this live event will stay posted to my Facebook page, so you can not only come back to ask more questions, but you can rewatch this if you don't remember everything I said, or if you didn't have a chance to take notes, you can rewatch this video. And that way you can, get a refresher if you need so. So I will also come back to this post in my Facebook page and answer the questions that I can, if it's not too personal or if it's not something that isn't appropriate. So I will do that. So just keep them coming, and I will get to them. So and to that person's question, when is yelling abuse? It's a blurry line, right? I mean, it's not an easy answer, and often with trauma, there aren't a lot of easy answers. As a therapist, I would come to help and support and hold space for children who have been abused and their foster families or kinship families who were now caring for them. And my first thing I would tell them was, I don't have a magic wand. I'm not going to have every answer you need, but I'm here to hold this pain for you and to create a little bit more space in your family for some positive interactions. And I did that by teaching the adults all about trauma-informed and trauma-responsive parenting. That was the most effective way for me to help the children. I'm sure the therapy I did with the children, was helpful somewhat, but I saw the biggest leaps and bounds in progress when I was able to reach the hearts and minds of the adults in the room and in their lives and teach them about trauma and how it impacts their brain and body and nervous system. So that's another important thing to consider there's so much out there. There's so much good content out there on trauma-informed and trauma-responsive parenting. I encourage you to go look for some of that and educate yourself as much as possible. So we also know that one of the things that heals trauma more than anything is our connections, our healthy, strong, supportive, loving, committed connections. People who are going to stick by the child no matter what. And if the child who's experienced abuse or abandonment even slightly believes that you might abandon them, I can tell you right now, you're not going to get very far with them. And, that's a really hard thing for adults to recognize and acknowledge. But we have to be ready to commit to being in this child's life for the long haul. Maybe that doesn't mean that you have to continue fostering a child that clearly isn't sort of working out in your family dynamic. I'm not suggesting that you have to be 100% committed to taking the child into your home, but you do need to be committed to staying in their life in some way. So I encourage you to have these lifelong connections with children who have experienced abuse and trauma, because that is what truly is going to help them heal over time. They need to know that people don't just throw them away and abandon them. They need to know that somebody, just even one person, will stick by them regardless of their behavior. In fact, they're going to show you the worst sides of themselves and the worst behavior when they're beginning to trust that you might not abandon them, because the people that we start to feel closest to are also the people that we show are pain too. And that pain can come out in these big disruptive behaviors. So oftentimes people think, well, this child I'm caring for is doing all these things to push me away. I'm trying to help them. I'm trying to love them. They won't let me. Well, that's because they're starting to trust you and they're fearful. They're fearful that you're going to leave again. So they tend to think, well, I'll just make it end on my own. So let's get this over with. This person's going to abandon me anyway. I might as well destroy this. And it's a self-sabotaging type of thinking that people develop when they experience trauma and abuse. So I encourage you to stick it out and stick with it for the long term if you really want to see changes in a child with trauma. We're at our half an hour just about, and I want to be respectful of everybody's time today. I really enjoy, sharing this information with all of you, and I love my Facebook audience. I have over 10,000 followers on my Facebook page, which is incredible. I never expected to have that many people following me, but it's really hard to reach those people, as I mentioned in a recent post, because of the algorithms and the way that Facebook wants me to, pay for ads and all of that stuff. So if you could do me a huge favor and just like this video, comment or share it with somebody today if it was helpful to you, that would be an awesome way to give back for some of the information I shared today with you. You can also join me in my private Facebook group, which is Emotiminds. I'll put it in the chat, but it's EMOTIMINDS. And it's a private Facebook group that I make sure is very safe and inclusive for everyone. I monitor the comments, I monitor who comes into the group. They're required to give me certain information in order to access the group, and it really is a safe place for you to ask questions, seek guidance, find resources, and support and love from complete strangers. So, there's lots more good in the world than bad. I still believe that. And even what we're going through, there's still more good people and mostly good people in the world. We all really need to remember that sometimes. And my Facebook group is a perfect place to find some of those good people. So I would love it if you would join us over there. We have about 5,000 people in the membership now, which is really exciting. I've just put it in the chat, a link to it. As a wrap up, I just want to say that if these techniques and these skills, these tips, they don't work for you or your family, that's totally understandable as well. Not everything is going to work for every child. I encourage you to continue to seek out ideas, different types of ways to connect with the child and build a relationship, because it's really not about interventions or techniques. It's really more about the relationship and the trust that you can build with one another. And but it's not, all this stuff doesn't work for everyone, and I understand that. So, and also, if you find that you really need to seek therapy, which I always highly recommend, I go to therapy. A lot of good therapists and good counselors out there are in their own therapy, which I just think is a sign of their strength and their commitment to the work that they do. So I suggest looking into something called EMDR therapy for children and adults who have experienced trauma. It's been researched extensively, and it has shown to significantly reduce the symptoms of trauma in just a few sessions. So that makes it cost effective, and also compared to other types of therapy anyway, it's still expensive, but compared to other types of therapy, it is highly effective, and also a short-term, typically a short-term format of therapy. And also always want people to understand that in order to help the child, the family members and the caregivers need to be involved in the therapy process. So individual therapy for a child Sure, will it make some movement? Will it make some progress? It could. But if you really want to make a difference, you need to be involved with their therapy and their counseling. So, that means you need to bring some of your own stuff to the table and start to look at how you can begin to heal the trauma that's living in you, because most of us have it. And that's okay. The human condition is one of suffering at times. And there's nothing wrong with having trauma in our past, but we can begin to acknowledge it and uncover it and do the healing process ourselves. And that will trickle down to the children in our lives and make our relationships stronger, which will help them heal. So I hope this has been helpful for you all today. I'm so grateful for everyone who attended. Again, please find me on my website at bethtyson.com. You can find my blog articles there. You can sign up for my newsletter there. I just put it in the chat. You can see the books that I have for sale under the shop tab, and you can reach out to me and schedule training or education for your community, for your organization, for your local nonprofit, or anyone who needs training on childhood trauma. I am so grateful again that you were here and took time to spend with me today, and I hope to see you soon. I'm hoping I'll do more of these in the future now that I've done this one. All right, let's see. I'll check the comments one more time. It's hard to watch these comments. Thank you, Christina. You have a great week too. And thank you, Victoria. Yes, granddaughters. There's a lot. That's one of my areas of specialization. She said her granddaughter's really struggling, and I published a children's book for grandchildren being raised by their grandparents, which is called A Grand Family for Sullivan, and you can also find that on Amazon and on my website at bethtyson.com/shop. To learn more about it. It's a great resource for not only caregivers and grandparents, but any relative who's raising another relative's child, and also social workers, school teachers, libraries, counselors, any mental health professional who works with children can really benefit from this book. Even doctors' offices. Oftentimes, doctors and nurses are the first people who are aware that a child is living in a grand family or a kinship family. And so having a book there available for those families to turn to for some guidance and advice could be really helpful in a moment of tragedy. So I hope you'll check that out and share it. And again, thank you guys for being here, and check back in the comments for answers to your questions. Thanks for being such an amazing audience. And I love all of you and all of the comments you make on my posts and the sharing that you do. I'm so grateful. I couldn't do this work without you, and I really, really appreciate anytime you hit that like, share, or comment button on my page. It just helps the information get out to more people. That's just how Facebook does it. Unless they get likes and comments, they don't show your content to anyone. So if you want others to learn about this and to have this as a resource, please like, share, and comment on my posts. I will talk to you all soon.